This assignment was made in response to an ethics and legalities class that I am taking for a part of a nursing course. We're supposed to discuss ethical issues that we've come across in our field of practice. I chose to discuss the topic of end-of-life issues that parents are faced with when their babies come in under the point of viability, 23, 24 weekers, or in some cases with chromosomal anomalies that are incompatible with life, that for some point or some reason were resuscitated at hospitals until diagnoses can be made that determine them incompatible. The problem or ethical dilemma that I deal with frequently in my field of practice is, I guess, the sensitivities of fellow co-workers, not intentional, but just that are unaware of the magnitude of the decisions that the families are faced with. It's easy for us to say that, I would never put my baby through this, or this is unethical or inhumane treatment. Why are we doing this? But when you're brought in a baby that, for all aspects of the word, is alive, we don't understand the magnitude of the decision it is to withdraw support. And it's easy for us to judge the decisions that families make. We'll never understand. It would have to be the most unselfish decision that any parent could make to end the life of a suffering child. I would just like to see that healthcare professionals and nurses in general, and physicians for that part, could step back from the everyday practice that we do and realize that it is a very hard decision to make, and who are we to judge when and what is the right time and what we would put our child through if in fact it was our child, and when we would make the decision that enough is enough. I just thank God that I've never had to deal with that decision. It's got to be the hardest decision that a family would ever have to make, and I would have to think that it would be the most unselfish decision, whereas we sometimes view the length of time that it's taken them to come to that decision as a very selfish decision. In the end, they just don't want to see their child suffer, and it is them who's having to deal with, hopefully with our expertise and our compassion, we can make it a little easier for them to come to that decision that, it is the best thing and it is the right thing, but, who are we to judge? We should just be thankful for the fact that it is not our child, and we aren't the ones having to make the decisions. We are not the ones who are going to have to live with the decisions. So who are we to judge at what point or how long it takes a family member to arise at that decision? And I just thank God that it's not my child that I'm having to deal with.